Well, as we've already heard, a public fatality report into the death of a dementia patient in long-term care found that staffing levels are insufficient and instructed that the province looked into staff-patient ratios. This is not addressed by the money following the patient policy that the government's talking about. Since a damning Auditor General's report in 2007, the NDP has been calling for action on this issue, and for those years the government has ignored this basic aspect of caring for our seniors. My question is to the Premier. Why has the government failed Alberta seniors by refusing to take action on adequate staffing in long-term care?
Mr. Speaker, no doubt what the honourable member would have us do is to regulate staffing ratios for all residents in Alberta and be completely indifferent, Mr. Speaker, to the very large number of people that require care above that level in order to adequately meet their needs. The honourable member has access to this information, Mr. Speaker. He can see clearly what the paid hours are that are allocated for long-term care, supportive living level for dementia, Mr. Speaker, which is the subject of this question, and the other levels of care that are provided in these facilities. Again, Mr. Speaker, the honourable member would do well to look at what we're doing today in continuing care, and I'm sure he would realize that it's a patient, resident-centred approach.
Honourable Leader.
Thank you very much, Mr. Speaker. Well, I have, but both the Auditor General and the Justice in this inquiry talked about the need for minimum staffing levels, and that's not accomplished by the government policy. Last weekend, Albertans in Cochrane rallied against patient-based funding, which this minister seems to think is the solution. But facilities like the one where this senior died are the ones that have suffered the most from his new formula, that have cost him the most staff. What's he going to do about that?
Mr. Speaker, herein lies the basic difference in philosophy between the honourable member and this government. We believe that public health care dollars need to be allocated based on the needs of the residents and patients that we serve in the health care system. And, Mr. Speaker, we believe that residents in continuing care facilities deserve no less than that. Mr. Speaker, it calls for a higher level of sophistication in this debate than to simply revert back to the policies of the 1960s and 70s, only provide one level of care for all patients, and to regulate or legislate the nature of the care that should be provided. These are individual residents, Mr. Speaker. They are supported by families and staff in the local communities that serve them. This was a very unfortunate situation, Mr. Speaker, and we certainly feel for the family, but the facts are the facts.
Let's continue without the interjections, please. Edmonton Calder. Thank you. Edmonton Centre. Edmonton Strathcona. Over the last few minutes. Let's carry on. Leader of the New Democrat Opposition, your third question.
Thank you very much, Mr. Speaker. Well, it's unfortunate that the Premier doesn't care enough to get up and answer these questions. This government can't be trusted to protect our seniors. This government can't be trusted to provide our seniors with the kind of care they deserve. This government can't be trusted to build long-term care beds for our seniors. To the Premier, will this government start rebuilding trust with Alberta seniors and commit to finally legislating staff ratios in long-term care facilities?
Point of order has been noted by the Government House Leader at 2:10. Honourable Minister.
Thank you very much, Mr. Speaker. Well, there is no greater defender of seniors in this province than the Premier of this province, Mr. Speaker. And until recently, no one has showed a greater interest in actually matching the resources that we have available to serve a growing number of seniors, Mr. Speaker, some of whom have very, very high care needs, than the Premier of this province. And, Mr. Speaker, we will continue in our commitment to open 1,000 new continuing care spaces per year across the province. We're on track to reach our goal of 5,300 over 5 years. All of those beds, Mr. Speaker, can accommodate all levels of care, including those with dementia.